today's topic is necrosis. So first thing we discuss, that is a definition of a necrosis. What is necrosis? Necrosis is defined as the localized area of a death of a tissue followed by later degradation of a tissue by the hydrolytic enzymes liberated from the dead cell. It is invariably accompanied by inflammatory reaction. So what are the things happen during the necrosis? One is death of the tissue, degradation of the tissue, and inflammatory reaction. So here the first is death of the tissue, then degradation of the tissue, and last one is the inflammatory reaction. These are the steps of the necrosis.
Now the causes. What are the causes that causes the necrosis? That is hypoxia, chemical and physical agents, microbial agents, and immunological agents. These things causes the necrosis. And the types. There are 5 types of necrosis. First is coagulative necrosis. Second is liquefactive necrosis, gaseous necrosis, fat necrosis, and finally is fibrinoid necrosis.
First thing is our coagulative necrosis. But it is the most common type of a necrosis. What are the causative agents?
Irreversible focal injury, then sudden cessation of blood flow, and bacterial and microbial infection. In previously I also said that the causes are bacterial and microbial infection. Here in coagulative necrosis it plays a very important role.
Then what are the organs affected by the coagulative necrosis? Mainly heart, kidney, and the spleen. Grossly, it is seen that the affected area of that organ is early stage is pale color, and the means fibrosis are very strongly slightly swollen is called as infract. What is infract? Not properly blood supply occurred to that area. With progression, this is the early stage, there will be pale, but with progression the affected area becomes yellowish with softer and shrunken. Shrunken means seizures of the size of that organ.
Next is microscopical structure. There is conversion of normal cell into tombstone. What is tombstone? That is the outline of cells are restrained and cell type can be recognized, but the inner cells are completely damaged but the outlines are retained. And then necrosed cells are swollen and have more eosinophilic cytoplasm than normal. The eosinophilic cytoplasm is in all 5 types of necrosis, it is more than normal. So then what happens? Then cell digestion and liquefaction fails to occur. Here no pus is occurred, and then dead cells are phagocyted leaving granular debris. Dead cells are phagocyted by macrocyte and then it just leaves the granular debris.
This is the gross and a microscopical view of coagulative necrosis. Next is liquefated necrosis. Just as previous, we discussed in the coagulative necrosis the causes, organ affected, gross view, and a microscopical view. In that same manner, we discuss first thing of the causes of the liquefated necrosis. So how liquefated necrosis occur? Due to the ischemic injury. What is ischemic injury? When there will be hypoxia occur, there will be ischemic injury. So which example of a liquefated necrosis? One is bacterial or fungal infection causes liquefated necrosis, and a hydrolytic enzyme when degraded causes dead cell to form the liquid form. Dead cell becomes liquid. That's why its name as liquefated necrosis. So what are the that is infract brain and abscess in the cavity, which also comes under liquefated necrosis. What is the gross view of a liquefated necrosis?
Grossly, the affected area is so soft with liquefied center containing necrotic debris, but in coagulative necrosis there is no liquefactive center, so no pus is formed. Here the cyst wall also formed. Microscopically, the cystic space consists necrotic cell debris and macrophages, where in coagulative necrosis this does not occur. Cystic wall is formed. Cystic wall is also 2 types. One is proliferating capillaries and second is proliferating fibroblast. Proliferating capillaries and then inflammatory cells of glottis. It occurs in case of brain, but proliferating fibroblast it occurs in case of abscess cavity.
This is the infract brain of liquefated necrosis. Gaseous necrosis, third type of necrosis, that is gaseous necrosis. what is its causes or where it is found? It is mainly found in the center of a foci of a tubercle infection. So microbacterial tuberculosis is the most common cause of a gaseous necrosis. It has a combined feature, that is both coagulative and liquefating necrosis. So in the gaseous necrosis, when you go towards the histology slide, you see both coagulative and liquefating necrosis was seen in that necrosis. Then which type of organ are affected in that necrosis? That is our lungs. So what happened? The foci of the gaseous necrosis resemble as a dry cheese. So that is the name. That's why it is known as a gaseous necrosis. Why? Because it look like a dry cheese. That is, they are soft, granular with yellowish coloration. So their appearance is due to the histotoxic effect of a lipopolysaccharide which are present in the capsule of a Microbacterium tuberculosis. That's why the most common example of a gaseous necrosis is tubercular necrosis, tuberculosis. That is the most common cause. Then microscopical view.
The center of necrofoci contains structureless or eosinophilic material having scattered granular debris. I also said that eosinophilic material is more in all types of necrosis. So here also the same case. And the surrounding tissue shows the granular matter's inflammatory reaction. There are several types of inflammatory reactions, and the one of them is granular matter's inflammation. Here it shows this, and it consists of the reactions like epithelial cells, intersuppressed giant cells of Langerhans, and foreign body type.
Now this is the example of a tuberculosis lung of a gaseous necrosis. Then our fourth type of a necrosis, that is a fat necrosis. Why it is called fat necrosis? We just discussed in later. That is, it is a special type of a form of a cell death occurring at mainly fat-rich anatomical location. That's why it is called fat necrosis in the body. So what are the example? One is a traumatic fat necrosis as the breast, and a mesenteric fat necrosis due to the acute pancreatitis. So what happened in the mesenteric fat necrosis? There will be due to the acute pancreatitis, there will be increase in or reloaded of the pancreatic lipids occur, which leads to triglyceride or level increases, which when reacts with, if we give a calcium dye, it leads to a saponification view, which is the confirmatory tissue necrosis of a fat necrosis. Then what is a gross?
Grossly, it appears as yellowish white and firm deposits. Due to fat, it appears as yellowish white, and microscopically, necrosed fat have cloudy appearance and are surrounded by inflammatory reaction. So, due to saponification, the cloudy appearance occur, and we just know that this is fat necrosis.
Those things which we discuss in the fat necrosis, this is the acute pancreatitis of a fat necrosis. Then fibrinoid necrosis. Fibrinoid necrosis is characterized by the deposition of a fibrin-like material with staining properties like fibrin. That's why it is known as a fibrinoid necrosis, such as a phosphatidyl acid hematocyte, that is a PTAH stain. Example of the fibrin necrosis which causes the staining is that PTAH. Then
example is in autoimmune vasculitis. Vasculitis means in blood vessels. So it occurs in blood vessels or in autoimmune diseases, and also in arthros reaction. Microscopic, it has not a very significant gross view, but it has microscopically, it is identified by brightly eosinophilic hyaline-like deposition in vessel wall. That means all the necrosis has high condition of eosinophil in their cytoplasm.
This is the histology of a fibrinoid necrosis containing the fibrinoid artery. Discussing all the five, there is some gangrenous necrosis was given in the Robbins pathology. That's why we discussed that also. That is gangrenous necrosis. What is the causes? That is when there will be blood supply is less, that is maybe in the organs or maybe in the limbs, it leads to coagulative necrosis. So coagulative necrosis increases from the superadded bacterial infection which leads to liquefied necrosis or wet granule. That's why it is known as a gangrenous necrosis. In this way, we discuss all the types of necrosis and causes with a gross view and a example and a microscopical view. So this is all about the notes, and if the question asks the types of necrosis and the definition types, I hope you understand well. Thank you very much. Have a nice day.